Now, this nephrotic syndrome issue that we've been talking about, and we have mostly focused on the acquired one. That's like you're having nephrotic syndrome, which is damage to the kidney as a result of maybe an infection, maybe a systemic disease like hypertension, diabetic mellitus, and all of that. But there's also a nephrotic syndrome that somebody is born with it. So we call that the congenital type. So we're trying to possibly give the possible reasons to why somebody can be born with a kidney damage that is making them pass out proteins in urine. So these are some of the symptoms. Okay. So congenital nephrotic syndrome is rare. It's not common like the acquired one. So you see it in infants that were born within their first to 3 months of life, you know, and it's most commonly because of there's a mutation in these genes known as the NPHS1 and the NPHS2 genes. So what are the features? You see them with symptoms of nephrotic syndrome, edema, personal protein in urine within the first 3 months. So there's massive proteinuria, they are losing so much protein, so protein levels in the blood is reduced, edema, ascites, you know, their cholesterol levels are high, and sometimes they could be passing blood in urine. So this could lead to anemia, abnormal clotting profile, their immune system is weak, so frequent infections due to low immune cell counts. Okay, and it could lead to end stage renal disease. Do you understand? Where the kidney has deteriorated so much. Yeah. It's an image trying to illustrate the glomerulus and also the nephrons. So genetic basis, we have mutations in the gene known as the NPHS1. That one we call it the Finnish type. It's very common in Finland. Okay, we have the NPHS2 mutations. It's global now. The other mutations can have mutations in genes like the WT1 LAMP, the LAMP2, the PLCE1 genes. Okay, inheritance is autosomal recessive. Both parents must carry a mutated gene for a child to have it. So symptoms in infants is low birth weight, generalized swelling, decreased urine output, foamy urine, poor appetite and malnutrition, and your immune system is weak, so the infections are coming over and over. So high blood pressures, abnormal heart sounds, and abnormal lung sounds when they try to examine you. So you diagnose this from urinalysis, blood tests, prenatal screenings, and you now do a test to confirm that there's a genetic mutation. So for management, you give diuretics if there's fluid overload so that they can pass out more urine, angiotensin converting enzyme inhibitors, and also NSAIDs that will basically try to tackle out the inflammations. Then also antibiotics if you're suspecting that there's an infection. So advanced interventions, if the kidney is too damaged, just remove it. Okay. And dialysis as a bridge for transplant. Okay. So this is what we have for the congenital type of nephrotic syndrome.